Childhood ear infections and your child's ear tube, also called myringotomy, placement. This short video will provide information about the surgery and what to expect afterwards. What is an ear infection? Also known as otitis media. An ear infection is usually caused by bacteria, which leads to inflammation and fluid buildup inside of the ear. It is most common in children. What are the signs and symptoms? They may include tugging of the ears, fussiness and crying, trouble sleeping, fever, fluid leaking, problems with balance, and trouble hearing. Here are some tips for preventing further infections. Make sure your child gets a yearly flu vaccine. Wash hands often with soap and warm water. Avoid exposure to cigarette smoke. Don't put your child to sleep with a bottle. And limit exposure to other children who are sick. So how do ear tubes work? The surgeon will make a tiny cut in your child's eardrum, remove fluid from the inside of the ear, and insert a tube. This allows air to move freely to decrease the number of infections and improve hearing. The tubes will fall out in 6 to 12 months. Your doctor may occasionally check to see if they are still in place. What to expect after the surgery? Expect to stay on the unit for about 1 hour after your child returns, if they are doing well. Your nurse will periodically take vital signs and make sure that your child is comfortable. Then, they will talk to you about care for your child after ear tube placement. Pain management. Your child may experience some pain and itchiness for approximately 24 to 48 hours after the surgery. Give your child medication for pain as described by your nurse and physician. This will likely be a schedule of alternating acetaminophen, also called Tylenol, and ibuprofen every 3 hours. Use the dosage marked on the medication box you have at home based on your child's weight. Here is a sample pain medication schedule. Please talk to your nurse on the unit if you need further clarification. After 24 hours of giving medication every 3 hours, give pain medication only as needed, if your child is in pain. How to care for your child with ear tubes. Manage pain as described previously in this video. Keep ears dry for 1 to 2 weeks. Check with your doctor before letting your child swim, and never let your child dive while the ear tubes are in place. Your child can resume normal activity the day after surgery. There may be some drainage from the ear. You may clean the opening of the outer ear with a cotton tip dipped in hydrogen peroxide, which can be bought at your local drugstore. Never insert the tip inside of the ear canal, and call your surgeon if the drainage has a bad smell. Go to the emergency room if your child has trouble breathing, blue lips or skin, is restless or hard to wake up, has a constant fever higher than 38.5 degrees Celsius, or vomiting that will not stop. If you have any other questions or concerns, please see your family doctor. Thank you.